that is driving what we do and helping us stay focused, coming up with a common goal. And then we've talked about measuring the same things. And you'll hear a little bit more about that today in regards to the SMART goals that we're kind of putting out there for you to view and get some feedback. Using the results-based accountability as well to measure the work. And again, you'll see this theme: how much did we do? How well did we do it? And then is anyone better off basically because of us working collectively with all of our efforts? So Travis has done a good job of kind of putting some options on paper for us in regards to those three measures. Definitely wellness focused with wellness indicators, looking at prevention strategies to establish our baseline metrics. Talking about community gaps, bringing people together as we have. You've all been part of that and been at the table and continue to come to the table to identify those and now working to address those. So we appreciate that. And then here we are to our 2030 vision. Lots of steps to get here. And I think we've got really good buy-in and engagement with this. So this one I will read. So we want to make sure that Buffalo has communities that will have resources that are easy to understand and are accessible for all. We'll have access for basic services for all residents. We'll thrive when partners work together to coordinate services. I love the word thrive there. Get out of survival mode here and get more to thriving. And then we'll value all people and their voices will inform our work. So again, that very important piece of the lived experience and having that represented at our table. And then our collaborative structure is how we're going to implement all of this really to move into our vision statement of reality. So that's, I think that's kind of where we're at now as I've been following along. So does anybody have any questions about that so far? I feel like you've all been part of impacting all of that. So hopefully it shouldn't be new, just more of a recap. Anything I missed, Travis? Oh, go ahead.
Oh, you nailed it.
Okay. Questions, thoughts, anyone? Okay.
I don't have a question, Abby, but I just wanted to say, I really like the way they came together.
Yeah.
I just wanted to do a good job on that. It lays it out really cleanly. And even though we're deeply immersed in the work and we already think we understand it, I think a new person could read that and get it.
I agree. That's what's really important right now too, is being able to kind of push this work out farther. And so the group's done a great job of that. Michelle, you've done a great job of capturing it visually for us. So thank you.
Thanks, Abby. Thanks for running through that. And I think you touched on kind of the measurement part, which I think is what we're going to kind of spend some time here discussing today. I'll bring our agenda back up for us, Travis.
All right.
Okay, if you want to switch over to that attachment with the SMART goals, I'll kind of start walking us through that a little bit. So we've been talking about this for a little while. And so there was some of the leadership group of us, Abby and Emily and Jamie and other folks and some of the staff have had a chance to talk through this a little bit. And so I want to give a little bit of background before we get to the actual goals themselves, because I wanted to make sure, for me, it was important that it aligned and it made sense. It could be, pretty easy to dive right into what's going on with the youth, adolescents, and children work group and just pick a goal there. But I wanted to make sure that what we were doing made sense based off of the conversations that we were having. So like I said, I read through some of the notes that I had over the last couple of months and the feedback that we've had. And so at the top there, you can see, really, I want our goals to align with what our backbone support organization, the Buffalo County's community partner, what that organization and what that board has for expectations of us, what the steering committee and really the well-being collaborative, which are one and the same, how that aligns, and then how that aligns to the first established work group that we have, knowing that we'll have others, as Abby just got done showing that flower petal diagram with our different areas, and at the center of that is our impact statements. So I reviewed the impact statements, took a look at the results-based accountability model that Diane and others have been educating us on, and wanted to make sure that all of that kind of made sense. So you can see there, just to kind of ground us, at the center of the work groups and in that flower petal, it says impact. And those impact statements are obviously increase access to information, resource trainings, programs and services, and then prevent persons from entering or re-entering the system. And I'll apologize in advance. Some of my goals, maybe the terminology needs to be updated because that was in the feedback, and the feedback that Abby and others of our group gave us is that defining or using different nomenclature than entering the system. And so that's a piece that we can discuss today, or we can talk about, but I don't want anyone to get hung up on that. I fully admit that that may not be the most current terminology or the way that we want to describe those things, but that's just the way that my mind worked at the time, so I apologize. So we had the impact statements, and then the next piece was taking a look at measuring that impact and the results-based accountability. So there's some of more of the traditional things that we've taken a look at as far as how much do we do and how well do we do it. So how many services did we deliver? And then is there some type of a quality measure of how well we did doing that, or an efficiency measure? So how much did we do? How efficient were we at it? And then I think the piece that we really want to capture, and I keep going back to months ago, one of our breakout sessions when Josh Arias, when he was here, was talking about the program, some of the youth programs that he was doing, and he didn't focus, and me, I was asking more of a traditional question about how many kids did you have go through the program, and he answered that question, but then what he got to, which I thought was much more impactful, was talking about, is anyone better off? And he would tell stories and describe some of the results that some of the individuals going through the programs and receiving services were having. So I think that is anyone better off is a very important piece of what we want to do. So knowing all of that, making sure that we want to align all of these things together so that it makes sense, that everything that we have done up to this point we can capture. If you scroll down a little bit, Michelle, wanted to put together again those SMART goals. And just a quick recap with the SMART goal, our idea behind that is that it's simple. So not simple as in easy to achieve, but simple to understand. So to the comment that was just brought up earlier by Diane, when Abby was going through kind of what we've done so far, I would love an outsider to sit down, read our SMART goals and go, oh, I know exactly what you guys are doing. So easy to understand, easy to digest, and then measurable. So we need to be able to show some type of quantifiable change within that so that we can demonstrate an impact. It needs to be attainable, realistic, and then also time sensitive. So you want to accomplish these things. What is the time frame that you want to accomplish these goals within? So that was kind of the basis of all of this. And so we put together 3 different goals for you guys to be able to demonstrate feedback on. And my thought is these are goals that are goals of the Wellbeing Collaborative and of the steering committee. Yes, it overlaps, and these goals are more related to the YAC work group. But I think this is kind of a high-level pulse on how that work group is doing. We talked about this before. I don't want to tell that work group how to do their work, but I think the work that they're doing, this will demonstrate at a high level how successful that is. Within that work group, if they have other measures and metrics that are maybe kind of a little bit more detail specific and they want to capture some of those, that's perfectly fine. In fact, I would encourage them to be able to say, hey, let's take a look at this focus or this thing here. But as far as how things align and the scope of responsibility within the Wellbeing Collaborative, I thought that these were at least a good starting point for discussion with this team to be able to see what their thoughts were. So goal number 1 there, I'm sure you've already read it, increase the number of youth, adolescents, and children served by the Buffalo County Wellbeing Collaborative members from X to Y. So I know that there's still some work to be done here, but within those agencies that are providing services, at a high level, tell us today or historically 2021 or wherever your breakdown is, how many people have you served? And then what would you like to do by this date? And we could talk about this too. I thought it'll probably take us a little while to talk through and flesh this out. So probably roughly a year of collection for these goals by the end of next year is kind of what I was thinking. So that as we kind of take a look at the results-based accountability model, so that's how much we do. So that's kind of our quantifiable goal there. Then secondly is decrease the number of youth, adolescents, and children. And again, I apologize for my nomenclature, but from re-entering the system. And so again, taking a look at X to Y. So how many people do we have that are coming back for services that we shouldn't anticipate we wanted to come back for services? If it's appropriate within your program to have return folks, or if they're progressing through in a certain way, that's completely fine. But it's those folks that you thought, okay, this person, hopefully they're a success, and then maybe they come for services again because for whatever reason they needed to come back and re-enter that or need an additional services. So that's the how well we do it. So that's more the efficiency measure. So quantity, efficiency, and then we wanted to capture that, and this is a little bit tougher because it's a little bit more anecdotal. It's storytelling, I think, but it's people talking about living through their lived experience and the success of these programs. So I just threw out there, let's celebrate a certain number of stories, and I threw out maybe publicly. So at least this group or within the agencies. But if we're going to move the needle for the whole community, I thought maybe there's an avenue where we can share some of the successes of the work group and these agencies that are performing the work. Let's help them. So if we have this big group, let's be able to get these stories out there. And that's is there anyone better off? So I know that's a lot. And I don't think as a team we're married to this, but it was kind of our logical follow through and rationale as to how we got to something for you all to be able to digest today. So I'm going to pause there and just open it up for any comments related to anything we've talked about.
You know, as far as goal number one, that increase the number of served, could we break that down into preventative and intervention? I think that's really important to know how many are being served in our community in preventative services versus intervention.
Yep.
And the second one is the system. And I know you struggled with that. I could tell, Greg. We've got to define what the system is. Is it people seeking treatment for mental illness? Is that the system, or is it the system that we're talking about? Is it our police and the courts?
Abby, I just saw that you went unmuted there. You're more eloquent in this. Do you want to maybe touch on Dr. Schaefer's comment there?
Yeah, that's what, like Travis was saying, we kind of struggle with that word because it can have a negative connotation for most people. I actually like what you kind of proposed there, Dr. Schaefer, though, that there is a system that we want people to take part in, which is preventive services. We urge them to take, and there isn't necessarily a negative part of that. We want them to engage in that, but I like kind of how you said intervention, like there are services in the system that have to intervene, kind of on more of a mandatory or, type of way. I struggle with this too. I really couldn't give Travis an idea of my thoughts of what to change it to, but you have kind of a good start on that. So I think, there are systems we want people to take part in, and then there are systems we want people to remain out of.
And I think the other thing, Abby, is that I see some families in both systems, which is great. But to me, they're different systems from intervention and prevention. And somehow we just need numbers
Mhm.
from our community about where we are in those type of, and I'm not sure how to get that.
know.
That's a question.
I see there were a couple
Yeah.
comments in the chat there too. And Erin, you can elaborate on this, but she listed out some of the systems from entering or re-entering foster care, jail, probation, expulsion, suspensions. And then Michelle listed a comment from Emily's email between our smaller group earlier this week. You can kind of see that where it talks about support systems, formal, informal, church, school, mentors, and some other information listed out there. So hopefully we can, Michelle, get some of that captured into our notes here, some of the chat comments.
Yeah. Yeah, I'd be curious what other people have for thoughts, because it is a challenging term that should be challenged. I just don't know what it should be.
I don't have the answer, but I felt like when we put that goal in place, we were talking more of the preventative, or not the preventative, oh God, yeah. I mean, you want those systems in place that are preventative.
Mhm.
So I don't know how we word that differently, because we want to keep them out of the negative systems.
Yeah.
Right.
It's almost kind of like this, I'm just throwing this out here, it might not, I haven't put a lot of thought, but preventative versus responsive services in a way, like these types of services in the system end up having to respond if the preventative measures potentially aren't followed or complied with. I don't know. I think we all know what we want. We just can't put a term to it.
Oh, Diane, you're muted. Maybe she.
Oh, shoot.
Diane, are you trying to talk to us? You're muted.
Sorry about that. I clearly thought my mic was
You're
on.
fine.
Okay. Good thing I gesture a lot, huh?
We can tell you were passionate about it.
My hands can't sit still
Go for
ever. No, it's occurring to me that maybe we need to think about this in terms of two different goals. One where we want to see areas where the numbers of users are increasing, and I'm not sure about the vocabulary on this, but there are certainly some areas where we want to see more people taking advantage of services. And then there are certainly other areas where we want to see fewer people entering systems like, criminal
Mhm.
justice system, foster care system.
Mhm.
So is it to that point and what people are saying, and if it's not, but so is the first goal then needs to be more defined about increase the number of those, I guess, preventative services or whatever we're trying to say. And then for the decrease, we want to decrease those responsive or interventional type needs.
Just to kind of keep the brainstorming going, I think I mentioned this before. I guess from my view as somebody who provides the interventive services, we want to be careful that our measure isn't that we're decreasing people re-entering, because that's not necessarily a bad thing.
Yeah.
We have to be very careful with that, because somebody could discharge or leave a service or system very successfully, and due to whatever out of their hands or out of their control or in their control, do need services again. And we don't want that to look like that's bad. That's where that negative connotation comes from using services, is we're trying to decrease people using these services. No, you wouldn't want people to not go to the ER or not go to the doctor. We want them to go do those things. So again, I think we want to be very careful how we're measuring this.
So
What kind of services are you talking about? I mean, because to me, like counseling, going to the ER, going to the doctor, those are not negative systems. Those are positive systems that you want people to utilize.
Well, I guess it's the same thing, like going to your primary care doctor is like going to counseling, I guess, and the fact that it's an outpatient kind of level.
Mhm.
ER is more emergent. And so if you're looking at inpatient hospitalization or a higher level of care, because that is what is more emergent or needed in the mental health or behavioral health system, again, that's not bad.
I agree.
Yeah.
So same with foster care. I know we don't want kids in harm's way that they're being removed, but we want kids who need to be removed so that we can work on a process to make that family system stronger. So again, I think we want to just be very careful with this idea of people not using them, because even when we think of foster care systems, probation, any other system like that, we have this negative, like, ooh, you're on probation, bad. Yeah, you did something to get there. Okay. Or yeah, oh, parents did something that the children had to be removed. Again, those services are there to help, not hurt. And so I think that's where some stigma comes sometimes, is we have this like, yeah, these usually people, certain systems don't get involved until something, I guess, a negative something has happened. But again, then we view this thing as bad, as them entering the system, when it's not. They're here to get what they need to be better, to feel better, to, promote the family system, to promote their own support system. I'm sorry, guys. I don't want to be like
No,
the,
No,
I love
I-
that you're pushing it, because I do agree with you. I'm wondering if we're focusing on the wrong thing then, like I feel like I shouldn't say that. I feel like for me, maybe it's the frequency of re-entering that is more
Yeah.
concerning than the actual system.
And
Or the
No.
resource.
I think we're trying to break this down into good and bad,
Yeah,
and I don't think that's the right way to approach it.
Yeah.
I think there's preventative, which we know is good.
Mhm.
I like the term responsive. I
mhm,
really do. I hate the term negative.
yeah,
Okay. And maybe we need that responsive. I love that term just because we're responsive to the needs of the community when they need it.
and
And
I'm
that-
with,
And that's very important to know what that responsive need is. So let's just use you, Jessica, and your organization. Are you at capacity? We need to know to figure out a way to get numbers, to figure out how responsive we can be. If somebody has a crisis today, can we be responsive today, or are we going to have to wait a month? How
correct.
do we solve that
Mhm.
response? Is it having to go to the ER, which we know is not, it's
Yeah.
great if you have a crisis, but it's not very good for problems that can't be, solved in an emergency
Mhm.
basis.
Right.
So I
And of
just
course,
think,
access.
you
Yeah.
want to use more, and I think, again, we're always looking at that frequency. Like if somebody is
So-
a high utilizer of higher, an ER kind of system, we want to look at what's needed before there to help families, individuals, so that we're not utilizing. But it's not that we don't want
Yeah.
them to utilize, it's just we want to look at how, like, what's going on, that we go from outpatient counseling isn't enough to now we're in crisis and we're having to use this higher level of care.
Yeah. Well, you've got me thinking about how we look at it in healthcare is we want to make sure people have access to the level of care and support they need, but that they're appropriately using the right level or the right intensity of services. Yeah, like it's not bad to use the ER when it's meant to be used for the ER. But if we're frequently using the ER, we need to ask the question, why is it the ER? Is it an education thing or is it an access?
And Dr. Schaefer hit it. So if we don't have enough responsive services, what ends up happening is people end up using these higher levels because their needs aren't being met at one level. So they continue to grow until it's just like if you don't
Yeah.
take care of your physical health, what ends up happening? You end up at the ER because You weren't either things weren't accessible or yourself weren't doing those things to help yourself stay well. And now we're needing more intervention.
I think the first goal is what captures that. I think the first goal is pretty solid for me. Because if we are educating people about the resources that are available, we're referring them to the appropriate levels of care, and they have access to them, we're going to see that number increase on that preventative measure. I love the third goal. I think it's, yeah, just kind of mulling over the second goal.
Denise, I saw that your hand was raised there for a while. Did you have?
Oh, yeah.
Yeah, thank you. And I just actually pulled off of the interstate, so perfect timing. I really love everything you guys have been doing today. So just love the language you're using. Just doing a happy dance all the way down the interstate. I'm wondering, and I love where you're at. I'm just going to introduce a couple other thoughts, and if they fit, great. If not, not a problem. But I almost wonder if there's a business acumen to this. Something around the intervention services being high cost, that would speak to people in the community, because I think we're all looking at that cost, trying to figure out how to reduce that cost. Interventions are very costly. So if that could be part of that, that language. And then I'm trying to kind of think about, gosh, what was the word that Abby and Dr. Schaefer used? Responsive. I'm wondering if there's a way to tweak that even a little bit more to like a return on investment for the prevention investment in the community, right? By investing in prevention, you're reducing those high cost of overutilized interventions. So I'm just throwing that out for you to consider. If it fits, great. If not, that's fine. I just thought maybe a business acumen language might help really communicate people in an easy way about what we're trying to accomplish.
Good perspective. Yeah.
So I'm getting back to thinking about prevention, responsive services, and then really intervention services. And I would say that those are court ordered. I mean, we want to get away from people being ordered into doing this, and we want to monitor that number because that reflects maybe on our prevention or other things that we're doing in our community or society. So maybe we want to get back to three types of things. The higher being the intervention, the court-ordered services, because people aren't responsive. You know, they're out of control. So I just want to bring us back to that, trying to figure out the preventive. I think we've got. It's that trying to get that system of being responsive to the community needs, be they mental health or physical needs, but also looking at the extreme. We have to have a way to tolerate, to get to the extreme. And maybe that's court-ordered interventions or certain type of hospitalizations or ER visits for suicide. I mean, it's, you know, you could use different examples of where, you know, we've reached a critical point in somebody's life that we need to intervene. And those we want to know about.
And you're right there. When we think about court ordered services, it's literally somebody outside of that person saying, we have to intervene now. We can't just leave it up to you. And they're very well needed, but you're right. Like that's a very different way of looking at it versus somebody trying to find these services and get access to these services on their own.
I'm not sure if you guys saw Emily's comment in the chat, but I think she had some really good language there. Maybe looking at accessing community resources to gain self-sufficiency for families, or maybe meet the needs of that family. Like that's kind of the conversation Jessica and Dr. Schaefer kind of goes along with that. You know, how are we actually meeting their needs? So Emily, I saw you came off or came on your video if you wanted to add anything, but I thought that was a great comment.
Yeah, so this just comes from that in-person meeting. Sorry, my dogs are here, everybody. A couple of weeks ago. And we talked about like kind of defining services, and that there are so many different services out there, and that can be, you know, support systems, that can be mentoring, that can be all types of different things. And maybe remove that service language altogether and look at kind of that preventative and responsiveness in the way of it being accessing community resources to meet their needs, making them self-sufficient. And that looks different for everybody. I mean, people can still be on state services and be self-sufficient. They can still be accessing food pantries and housing and be self-sufficient. But I think we have to really look at what systems means when we're looking at all of these, and maybe that's just language that we need to actually remove and better define. So that was just kind of the line of thinking we had.
Well, I think that that language works with, you know, if you're involved in a court ordered intervention, then you technically are not self-sufficient at that point. So it's kind of like the opposite ends of the spectrum. If you look at it that way. So I do think we could incorporate that verbiage somehow. I think when you look at how to measure it, which is not what I'm great at, but it being able to measure the amount of court mandated type interventions is, I think that data would be pretty easy to capture versus, self-sufficiency is a little bit more general for data wise, but I totally agree with the verbiage. I don't know, this is tough.
It is.
Yeah, I like the conversation though. I mean, we're pushing the status quo here, so.
We are.
I did really like Denise's comments as well. I hadn't really
Yes.
thought about putting the cost to those intervention services. And I know Dr. Schaefer, maybe Jessica Vickers, some of you guys who have been in some of our prior meetings, Healthy Minds, we were kind of going that way, right? How do we show that mental health, if we do prevention, that really helps the cost in the long run, right? And I know that's kind of like a lofty type goal, but I find that really interesting to think about that.
And I know I'm talking a lot. I just am thinking out loud, like comparing it to our world in healthcare with, what we call the triple or the quadruple aim. And we're really looking at access, cost containment, quality, those things. So I really like that perspective of potentially the decreasing the cost associated, with mandated interventions, I like that.
Is there anyone, I think we've heard from a good chunk of the group, but is there anyone that hasn't had any comments yet that they want to interject or comment on the discussion so far?
I have a comment. Well, I don't know if it's something I want to add to the conversation as somebody who's lived through personal experience with youth having suicidal tendencies and mental health issues. And we went to preventative care and we still ended up in the ER multiple times because of attempted overdoses. And it was next to impossible to get her into long-term psych care, which she really needed. And I guess I'm just putting that out there because if I'm, a middle-class educated person with a job and I can't find it, what are people going to do when they, have to depend on us, on public services, on social services? Sorry, that makes me emotional to talk about. I haven't said it out loud for a long time.
Thank you for sharing that, Michelle. That's very valuable. I appreciate you doing that.
I appreciate that, Michelle, because I feel like we do see that a lot. That we focus so much, there is this focus on preventative and like outpatient level services. But when we have folks that truly need those higher levels, when we talk about like what's the availability of them, it is hard. And that's why I kind of went back to my original comment is I don't want that to look negative, that we're trying to keep people from accessing those levels of care because they are crucial and important. And that's not bad. It just means we're getting somebody where they need to go.
Mhm.
Thank you, Michelle, for sharing that.
Yeah.
It was a tough one to say out loud. I hadn't talked about that for a while, and I know Denise knows about it because I consulted with her many a time about it, so.
But it's very important,
Yeah.
Michelle, that, I mean, that just tells us something about our quote systems
And yeah, in our community, you know, this
in our
is,
community.
this
Mhm.
is,
So
funny. We drove 90
don't feel
miles
bad. I think this is
to a
great.
psychiatrist. Yeah, no.
I think this is great.
Yeah.
We do finally have a youth psychiatrist. I believe he's still there at Richard Young for outpatient care, and I've thought a lot of him. But before he came, we were driving to North Platte to go for her weekly psych
Mhm.
appointments. And that was follow-up after Boys Town. So
Mhm. You know, it's a very good point to bring up though, Michelle, because that is an access problem that we have in this area. Especially depending on what the age of the child is.
yeah,
That can be very difficult to find an appropriate level of care for someone that's in crisis that isn't hours away from home, and that you may drive to and be triaged and then no guarantee of even getting admitted.
right.
So,
Well, and
It's a-
even like our short-term mental health is super inefficient. And I think part of it has to do with, it has to do with insurance. I mean, when it comes down to it,
it
you know,
does.
who's gonna pay for what? Will they pay for up to 5 days? Can you really?
Yeah,
I mean, that's triage right there, Abby. You know, it's like,
yep,
it's, yeah, it was really rough. And some of her stuff was court mandated eventually because it came to that point, you know, so
yeah.
putting it all out there today, aren't I?
But you're showing though that, again, like to Jessica's point, that there are good positive reasons for court ordered situations too, because sometimes when we get to that point, it means that we either didn't have the available or appropriate services, which is again an access problem, or potentially quality.
Yeah, you know, I guess that she did go on probation for like 6 months, and she moved with her dad in Reno. And that's been, I mean, a whole new group of friends, a whole new school. It's been a fresh start for her. And I'd say that she's a success story now. Of course, it's never over till it's over. We're all works in progress in some ways, but thanks, Denise. Oh, I'm going to turn off my camera because I'm going to start crying again.
Thank you, Michelle. I think it's so important for you to share your story. Obviously, it's very personal and passionate to you, but it's your feedback, and it's this group of people here who can help to hopefully drive some change for our community. I mean, that's why we're here. I mean, that's what you just talked about is exactly why we're sitting here today. So thank you so much.
And I think I'd like to reemphasize, you know, if we don't have that intervention group that gets to crisis, you know, and why they got to crisis, you know, we can't solve the problems unless we know about them
Yeah.
within the system. So I think that's, you know, we shouldn't look at intervention group as failure, because it isn't failure. I mean, it's people with mental illness have mental illness. You know, people that have heart attacks have heart attacks.
Well, and it's interesting that it's systemic, you know, it happens, all weird elements that all come together in a household, and generationally even, you know, come together. And I mean, I had a great grandma who committed suicide, and my grandma, her daughter, found her. I mean, I think that there's a lot of generational trauma that affects. And so I think another thing to look at would be, you know, serving the whole family and not just the patient.
Mm-hmm.
And I think that there are a lot of I mean, that's foster care does serve the whole family eventually, you know, hopefully families can be reunited. And I think a lot of our counselors that we visited with would try to include, you know, the whole situation within our family and understand what elements go together to make it happen. And now I'm just talking too much, so I'll stop.
Yeah.
This one does hit pretty close to home, though. It doesn't hit close to home. It hits home.
Michelle, this is Denise, and again, I just want to thank you for sharing. You're a very strong person, and I'm so grateful that you're on this call with us. I'm trying to think of some examples that are happening today within the system that we're trying to kind of put words to. And I thought if I gave it an example or a story, then maybe it would help us kind of make some connections too. I don't know the answer yet, but I'm hoping in telling the story it might be helpful. So I think you're mostly aware that we have a community response flex funding that's available for anyone in the community who is not able to access the services or pay for the services that they need in the community. So if they're needing food and it's not available, or if Salvation Army is done after 2 weeks in the month of being able to provide supports, families in those last 2 weeks are needing support. So we're getting those applications. Now, most people come in once, they get what they need, and we don't see them again. Some people, when they come in, have a few other pieces, and this is that complication piece that you guys are all talking about. There's multiple pieces that they're needing in the community. And so at that point, as the agencies are all talking, they're like, this family could benefit from coaching. And so the families asked if they would like to be involved in that. And then if they want to, then they can then meet with a coach once a week. Mm-hmm. And so after that, it's been going really well. We've been able to kind of see where those really high utilization of services are and start to really identify those gaps in the community. And then just last week, Tana and Wanda and I were kind of talking around a particular case. I'm going to try to keep it general so I'm not identifying. But we happened to have a family who was in daycare that was needing supports for childcare payments. And so as we talked through that, we're like, why could we not use the coaches we have on the early childhood side to become the coach model that we have on the community response side? So we're just starting to pilot that. So I don't know if I explained it very well, but I'm just trying to show how those things are starting to connect with those families who need more services. They need a navigator in the community that can help them shop those services. We have a lot of people with Alzheimer's, dementia, drug use, prison, coming out of prison. Those are the cases we're talking about most often around the table. And those are high cost prevention or intervention systems that we're talking about. I don't know if that story is helpful, but I think we can get to that data, I guess is what I'm saying. It's trying to figure out the language that really meets what we're trying to do.
I'm going to throw one more monkey wrench out here to further problematize, is that how you say that word? The situation. When we get with monolingual, non-English speakers, there's a real dearth, and I've been on multiple meetings with a lot of you about that exact problem, especially during the pandemic. But we also found anecdotally that mental health services were probably, both because of the cultural stigma of seeking out mental health services when you're Latino, but also because of this unavailability of professionals that are able to help. We've kind of cobbled up a small group of available bilingual clinicians at this point, but that's a few people for, a few professionals for a large population.
Wow, this has been a phenomenal discussion today. Probably my favorite one that we have had, at least the most impactful one, I think, that I can recall in recent memory for sure. So that has been awesome. maybe first off, are there any other comments or anything else to add for the discussion before maybe I try and at least summarize a little bit of what I've heard so far today?
Okay. Yeah, Travis. Okay, sorry. I do want to comment, but go ahead.
I'm trying to like just soak all this in and trying to relate it back to youth, children, and adolescents. And I guess what would be our goal for youth and children and adolescents to have a thriving community, to have a thriving life? Are they thriving if they're going to jail, in probation, in and out of foster care? I don't know. I'm trying to get away from the negative too. Like, I don't know. Thinking out loud, sorry.
Mhm.
That's all. I don't know. Just trying to like process all this and how we can change that maybe into a positive. But I'm not wrapping my head around it.
Something
that just, oh, go ahead.
I was gonna say that is hard, Erin, and I guess it's very complex. And that when I think about a child thriving, and there's other systems involved, it's usually because there's generational things happening, and so where do you start? Where do you start intervening? And usually it's, you can't just intervene at one level with a child. You have to intervene at a holistic level, multiple levels, at several different points, with the parents, with the kids, the community at large. Like it is hard to wrap your head around, and I agree with you. But I guess when I think about when we think about these systems, especially when we think about youth, it gets more complicated because there's usually a family component with it, if that makes sense. That they're not necessarily, that maybe due to their whatever life circumstances or situations, or even just life events that happen that can really impact a family and flip them upside down. They may approach at one of these systems, and at the moment they may not be thriving, but if they participate or are engaged with these systems, at the end of it, they might be thriving. Maybe thriving, hopefully be thriving.
Well, and I mean, I'm going to put my heart on my sleeve. My youngest is in counseling and OT right now for some major aggression at home. He doesn't like me sharing it with anybody because there is a negative behind that. Like, he doesn't want people to know he's in counseling. And to me, I'm like, it's not negative, buddy. Like, this is a good thing. You are getting the help you need. And we keep talking about that. So yeah, I mean, to me, that system is not a negative. Like, those are the kinds of things that we need to be promoting. Like, if you need help, you need help. Like, I'm there with you on that. If that makes sense.
Something that maybe just to consider, while you guys were talking, at my last job, I was in juvenile probation in District 9. And one of the themes that came up a lot was kids would say to me, programs don't change people, people change people. Mm-hmm. And something that I think maybe as we're like looking at these, some of the things that we have defined as system, maybe to me are more better defined as community, like the faith or whatever. Your church isn't necessarily a system. Your church is more of a church community, or your family or the school. Even the school, I wouldn't necessarily consider a system to most kids. Like, yes, there is the conveyor belt of the blocks and whatnot. But when I think system, I think, dot to dot to dot to dot to dot. Community, I think more like these are things that we aren't, oh, we're moving you to the next thing. We're moving you to the next thing. We're talking with you. You're involved in it. And you're coming with us. And I think maybe that's just something we don't necessarily need to use the word system for some of the things that we're talking about. That was a lot of just thinking out loud. Hope that was okay.
Diane, did you have anything that you wanted to add?
Yeah, I want to raise this, and I don't know if we want to develop this today or put it off for a future meeting. But I'm speaking on behalf of what most of you know as the Planning and Measurement Committee of Buffalo County Community Partners. It was recently renamed Accountability, Impact, and Measurement. And in that committee, we are working through some policies and approaches to operationalizing results-based accountability. And we're using some different understandings of those three questions that are reflected in these goals. So I think the one that I would probably, we can save this for a future conversation, because it's obvious to me that there's going to be more work done on these goals, but how we measure those is a little bit different. Like that second question, the how well we do it, really is being operationalized in terms of a quality measurement, rather than accounting how many people we served and how many people came into or out of systems, communities, however we end up defining that. The qualitative is really getting back into the user's own perspective of it. Did you get the care you needed? Was it timely? Did you feel respected by the providers? Was it affordable? Did it meet your schedule? And that's the how well we did it side. And then the is anybody better off gets at those individual success stories and the population level measurements that we can capture through systems data or community surveys, both.
I like the way that you just kind of posed that a little bit. It kind of flips the question a little bit. So instead of trying to talk about decreasing something in this whole concept, I'm just going to say it again, of re-entering the system or the negative connotations, and trying to kind of define what that is and what this whole conversation, the battle we're having here, maybe it's more about, so you can still have the success stories, but to the qualitative piece, maybe goal 2 is something more around the feedback of the individuals that are utilizing the resources.
Yeah.
What are their thoughts? Are we meeting their expectations? And that might be difficult. I understand it's with all the different components we talked about, sometimes people don't want to be in receiving the services they want. So they may not think that, to hell with this, these resources are terrible, but maybe that's a way to take a look at it too, is instead of decreasing something that may have a negative connotation to it, what's the feedback from the people who are utilizing, whether it's in preventative or a responsive service? How are they viewing that?
Yeah. That's definitely the spirit of question 2 of RBA, and that the quality is really in the eye of the user. Like how well we're doing it is really up to them to tell us, and we need to figure out how to ask them, but that's another problem for another day.
Okay, well, to wrap this piece up, and again, we're not done. We'll have another fruitful discussion next month, I'm sure. And next week we'll maybe not get into the entire depth of this discussion, but I think at a high level we can summarize what we talked about here when we go to the full collaborative and have a discussion with them about this. But I think some of the takeaways are goal 1 and 3, there's maybe a general consensus that those are okay. Work on the wording a little bit. Let's define that better, bring that back to the group. I think number 2 is the one where we either have to completely redefine what we're calling it there, scope it differently, or maybe take a look at it like we just talked about from more of a feedback qualitative measure. And I know that kind of, at the high level summary, it kind of cheapens the great discussion we've had over the last hour, but is that generally, are people generally in agreement if that's the way we look to move forward? And then once we kind of get set on goals, and I'm not going to say that's the easy part, but then we're gonna really need to probably rely on Diane and her committee and our agencies, because it's really great for this group to sit together and say, hey, we're gonna measure these things. People have to actually, I mean, we have to quantify that somehow. People are gonna have to gather data, submit it somewhere so that we can show a success measure or progress within those areas. So just food for thought for future discussion, but that's why I anticipate it'll probably take us a couple months to get exactly where we want to be with that. So thank you everyone for that discussion. I think that was phenomenal. So I think next on our agenda is maybe just to talk about meeting cadence. And I had a little bit of maybe a different perspective before we had this discussion and saw how much there was to still be done here. But Emily, do you want to just kind of maybe talk us through or lead the group through as to how frequent we should be meeting and go ahead, sorry.
I guess I don't have a preference on how often we meet, every couple, I guess, every couple weeks, 3 weeks, once a month. I guess I don't know what everybody else is open to moving forward.
I think the sensitivity is just knowing that this is largely folks who are, they're passionate about it, but it's not their day-to-day functional responsibility. And having this steering committee, having the full collaborative, folks maybe being involved with other committees or the YAC work group, I don't want to overburden, and then we start losing some steam because we're only having, a very small number of people showing up on a routine basis.
I think maybe if we meet as a steering committee once a month, and then we have those smaller groups that are meeting, like the YAC group. I don't know what the cadence for that could be, but I mean, probably once a month is sufficient. And then if there are things that we need to do in between, maybe we can send some messaging out surrounding that.
And Emily, maybe just an open invitation for those who are in this group to let us know when that cadence is too much, right? If they're seeing some duplicated efforts or we're stretching people too thin, that's something we really need to talk about as a group.
Yeah. Maybe we can send out like a doodle poll and see how everybody is feeling about things and maybe go that route, and then kind of circle back and decide cadence.
And maybe just a thought I had is maybe trying to decide what do we want to have decided by a certain date. So if we look at next month of September, right? Yeah. And then we have November, Thanksgiving, December, Christmas. So I know we kind of run into this busy time. So is there maybe one thing we really want to hit on before the end of the year? Because maybe our meeting schedule come November, December will get a little dicey. I know our office tends to take off some time for the holidays.
Mm-hmm.
I will get out a poll this week and decide how often we want to meet and get some feedback from everybody else. Sorry, by the end of the day tomorrow.
Thank you so much, Emily. I know that Jamie wasn't able to join us today, and she was going to talk a little bit about lived experience. And I think we had a phenomenal sharing session today, and appreciate all of those of you that shared personal stories with our group today. So thank you so much for bringing in that lived experience that helps shape what we do. Is there anything else on the agenda that we need to discuss for today, or are I think we're getting close to the end of it.
Travis, we did just, I think the last thing after that lived experience is an update from the Community Partners Board. And I know Kathy Gifford is on here. Kathy, I didn't know if you wanted to share anything just at this moment or not.
Well, first of all, I just really appreciate Diane's on here too. And so is Kent, Dr. Schaefer, but really appreciate all the efforts you're putting into making this steering committee work. There are a couple of things, and I kind of mentioned to Michelle in the chat, but we do need to have an actual approved description, definition, or whatever that's in the bylaws And I just applaud you because you're all forging ahead with what we're all passionate about, but we need to have that description for the bylaws because we did approve the other committees in our bylaws last month. So we need to have that finalized, and maybe the leaders in the group can just do that. And just make sure we have that so we know who's supposed to be on the steering committee and exactly what the role of the steering committee is as far as our bylaws is concerned. So we do need that. So thanks, great work, good conversation. I appreciate all you do. Dr. Schaefer or Diane, do you have anything else you want to add from the board of directors? Yay.
Michelle, would you maybe give us a little bit of a cheat here? Would you send out maybe one of the other committees from the board that has already submitted theirs? Could we just, maybe Abby and Emily and Jamie and I could take a look at that, and then we can help draft up exactly what we need to put in the bylaws?
Yeah, I was going to ask, I was just chatting to Kathy if we have anything drafted or not. So Kathy, we can chat about that. And then, yes, I think a good next step would to send it to the co-leaders, and then maybe we can send it out to the full group once we have something drafted.
Great.
I'm really excited about how you're all moving forward and you're using SMART goals and those kinds of things, but have some housework. We got to get in order.
Sounds good.
All right. That's all right.
Okay, is there anything else for the greater good before we go on with our day?
I just have a clarity question, maybe for Nicole and whoever else, is spending a lot of time with the subgroup. Is there anything that you guys need from us right now? I know there's a meeting, I believe, next week. I can't always make those, but
No, you're fine. I appreciate you asking, but I think right now we're just trying to come up with kind of some themes from the priorities that everybody had kind of shared. And so right now, I don't think there's anything that we need for that group in particular.
Okay.
Just kind of trying to figure out how to have that action move forward. And so
Yeah.
We're kind of excited about our meeting. We just met the other day. So I think that's going well. And we have some email conversations kind of going back and forth right now to kind of put things into categories or themes that we're seeing. And we're going to bring that to the table and see if there's anything additional we may be missing. We just want to make sure we capture everything and then really start picking our top priorities that we want to develop them strategies for. So thank you for
Okay.
asking.
great. Okay, thanks.
Okay, if there isn't anything else, thank you again for your time today, and we'll see all of you later.
Sounds good. Thank you, guys.
Everybody.
Appreciate all of you.